Show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning to the most beautiful city in the United States, San Antonio. Welcome, San Antonio listeners and viewers. This is the Ask the Expert show, where for the last 16 years, we've been bringing you the top experts in the field of legal, health, financial, and home improvement. Oh, do we have a great show for you for the next 25 minutes? We're going to be talking about Medicare. Now, I know the open enrollment time has elapsed, but it's not over yet. We were able to find the top Medicare agent in San Antonio. Let me welcome, I love the name of this group, Medicare Gals, the signature team, Susan Shimp. Good morning, Susan.
Good morning. How are you? Welcome to the new year.
Yes, Happy New Year to you. And I got to tell you, we got a letter about 2 weeks ago. It was right after one of your shows. And someone said that you're their agent and how great a job you have done for them. Because, Susan, when it comes to Medicare, most people, like myself, know nothing about Medicare until we actually get involved. And sometimes by then it's almost too late. And it's so important having someone like yourself to maneuver people through Medicare. Tell people about your company.
So yes, Medicare is one of the most confusing healthcare systems in America. And that's why we have made it our mission to help make it simple, easy to understand, and we educate you first. So my team, Medicare Gals, the signature team, we are here to be your resource. We are first and foremost education. If you know about Medicare, the ins and outs, then you can make better decisions. So we are there to help guide you, educate you. We help enroll you, but we're also there for you after the enrollment. So what if you get a bill, and what if you get a call that you're not sure about? Because there's a lot of scam calls out there, right?
Yes.
So we help tell you, is that a legit call, or is that somebody just trying to scam you? So we're there for you all the time. Basically, we're in your back pocket, if you will, to help navigate you throughout the years of being on Medicare.
Susan, I know I've shared this with you before, but I'm sure there's so many people out there who were like me. I knew nothing about Medicare. In fact, a friend of mine said, "Are you on Medicare yet?" And I went, "No." He said, "But you can enroll." I missed the enrollment period. Susan's laughing at me. But because I didn't know, and it cost me dearly. And I don't want people to have to go through that. And I want people to start making plans now, not wait like I did. So we want to educate you. But I want to say this, Susan, your job is so important, because my first agent I had in Florida, I didn't know they were bad until afterwards, when they only offered me one plan, because you represent a lot of different companies. And
Yes.
you offer more than just one plan. And it was like, okay, I guess this is what I have to go with. And I later found out there was better plans out there. So folks, it's so important that you get a good agent like Susan, because it can really hurt you if you don't. Susan, you agree?
I agree. And you want to work with somebody who is a broker. As a broker,
Yes.
we are contracted with all the insurance carriers or a majority of the insurance carriers. So we are not just pushing one plan or another or making sure that you're in one particular plan. If you go to a captive agent, now a captive agent is they only represent one company, and that's the
Mhm.
only plan that they can sell you, regardless of, whether or not your doctors are on that plan or not. They can sell just one. So always go local, always go with a broker. And that's what I am. I'm a local broker in the San Antonio, New Braunfels area.
Well, it's a new year. What does Medicare do now?
So, yes, so January is probably one of the most chaotic times for insurance companies and for consumers. And the reason is the new year, new plan, new rules, new pharmacy deductibles, new doctor copays,
Yes.
all that stuff, right? So the first time somebody goes and uses their plan, they're like, I didn't know that this deductible is on my plan. Welcome to 2026. Every year the deductibles start all over again. So
Mhm.
that's where a lot of people get confused and they're second guessing themselves. But January through March is the open enrollment period. So we just went through annual enrollment period, October 15th through December 7th. Now is the open enrollment period, January 1st through March 31st. So the first quarter of the year, say for example, you're not happy with your plan or you got a sticker shock at the pharmacy or your doctor's not in network or something like that, and you got on a plan that you're not happy with, you have the first quarter of this year to make a change. So you have that one-time option. I kind of say it's like buyer's remorse, where you
Mhm.
bought something, but then you're like, "Ah, I don't know if I want it. I want to return it and get something else." So that's kind of what this is.
So now it's the Medicare Advantage, which I'm on, and I got
Right.
to tell you, I really like my Advantage plan. But boy, are there changes, Susan? I was really shocked. 2 years ago on the same plan, I got eyeglasses, didn't cost me a dime, nothing out of pocket. This year it was $140.
Yeah, and unfortunately, a lot of those shiny benefits, like the vision and the dental and the over the counter and all those fun little extras that you get, they're being cut. With the government not paying Medicare as much as they used to be per month and all that stuff, with the insurance carriers, it's really causing them to take stuff back away from the consumers. And that, hopefully going ahead that we will have more options, but right now it's kind of tight.
You know what? From the letters we get, Susan, it seems like people are so confused from these national commercials
Oh, yes.
that make you these big promises. And what people don't understand, it's kind of broken down by county, isn't it? I mean, you could have one policy for one county, but it's different with the same company in another county.
So I have a prime example of that. So I have a gentleman who lives in New Braunfels, Texas, which most of New
Yes.
Braunfels is Comal and Guadalupe County. However, there's a small sector that is in Hayes County, which is the Austin service area, even though he lives in New Braunfels, which is San Antonio area. So he can't be on the San Antonio plan. He has to be on the Austin plan, even though he's in the San Antonio metro area, but he's in the just Hayes County, one county north by just a hairline. So, yes, all these plans have different counties, different benefits. What you may see, like, I'm getting that grocery card for like $500 a year.
Yeah.
You know
Right.
what? There's different counties. This is national. They don't just say, oh, San Antonio, you get $500. This is a national ad with a 1-800 number. So you're calling the call
Right.
center. And then they're like, oh, well, that doesn't apply to your zip code. So let me see what else we can find you. And then they can switch you into something else. So just be very cautious about
Crazy.
those calls and those national ads. Call someone local. We can tell you what's available in your county, and just don't get bamboozled. It's not fun because then you have to go through another month before you can make a change again, and it could hurt you.
Another question that we get is, uh, I'm not 65 yet. What age should I start planning to reach out to you?
So usually 64, a lot of people start reaching out because they're anxious to see what's going on. So about 64, usually you can't enroll into Medicare until 3 months before you turn 65. So usually 3 months before your birthday is kind of the key window of when you want to start that process. But if you're still working past 65, then that's a different story. You may not have to apply for Medicare because if you're still working and you still have employer coverage, or say a spouse is on your employer coverage and they're not yet 65, but they need that coverage for themselves, you might not want to get on Medicare because then your spouse might not be covered. So there's a lot of different
Sure.
circumstances, and it's basically comparing Medicare versus your employer coverage and seeing what's the best option for you.
Someone else also asked, do the bigger companies offer more than the smaller companies?
Not necessarily. So some of the smaller companies will offer a little bit more benefits, but here's the catch. They may give you more benefits, that shiny object dangling, but the network of doctors may be smaller. So you may have a limited
Ah,
amount of doctors that you can see. So yes, the bigger insurance carriers will have the plethora of doctors around the country, but they may not give as many benefits because they don't need to, because they have the doctor network. But then
gotcha.
other people will want just the extra dental, the extra money, all this extra stuff. But then you got to find a doctor. It's like finding a needle in a haystack to find a doctor.
Listen, I haven't even shared this with Susan yet, but if you've got a friend or a family member uh, that is getting ready to go into the Medicare, uh, we are replaying this show this afternoon at 5:25 Eastern time. I hadn't even shared that with Susan yet.
Nice.
So if you missed part of the show, if you want to, all they have to do is go to www.w4cy.com. Uh, Susan, if someone already has changed plans during the annual enrollment, can they still make another change now?
Yes, like I had mentioned before, the first quarter, January 1st through March 31st, is considered the open enrollment period. So it's where if you decide you don't like that plan that you're on, or you want to go back to original Medicare, you have that first quarter of the year to make one more change before you're locked in for the year.
Also, Susan, I want people to know if you don't understand this, um, if you're confused, kind of like I was, that's not uncommon. You hear that all the time, I'm sure.
95% of the people that walk in through my doors I have no clue about Medicare. But then you got some people who have already done their research and stuff like that. But 95% I say probably have no clue about Medicare. And they don't teach that. They don't teach insurance, and in school or any of the college courses. So it's really on you, and it's foreign language to a lot of people. I do this every single day, and so I know this in and out. So I can help guide you. My team can help guide you. Again, we're local. We have an office in New Braunfels. We can come to you. We can do Zoom calls. We can do phone calls. Our number's 210-767-9876. 767-9876.
We got a homeowners association contacted us, 55 plus.
Oh yeah.
Um, I sent them all your contact information. They wanted to know, do you ever come out and make a presentation to a big group?
Absolutely. That's one of the things I love to do. I love doing in-person seminars, because you can get a whole bunch of people in one room and someone can ask a question that you might not have thought of. So then you get really a lot of feedback and good questions asked. I do some 55 plus communities in the New Braunfels area. I've done some in the San Antonio area. So yes, absolutely. We love doing those. So invite us out. We'll come do
Good.
a turning 65 seminar, or if somebody's even on Medicare already, just kind of educating them further about their Medicare options.
What are some of the most common problems people are running into with all the new things going on with Medicare and their Medicare plans? What are you finding is the biggest concern, the biggest problem?
The biggest concern, the biggest problem is prescription drugs and higher copays and less benefits. So on the Medicare Advantage side, you definitely have, the copays have gone up significantly, maybe doubled in some cases. Prescription drug deductibles based on, if you have those injectable drugs or anything for like AFib or something like that, those deductibles have gone up a little bit more. And then they've taken out some benefits. Also, on the Medicare supplement side, which is original Medicare, those prices have gone through the roof. They have increased dramatically that people are like, what's going on? They can't afford it anymore, so they need to find other options. So there's a lot of changes price wise out of the consumer's pocket that is hurting people for 2026.
Got something for you to do some research on for our next show next month
Sure.
because we're getting a lot of letters. I don't want to make this a political show, but people are saying, I saw the president speak that he's dealing with all the major drug companies and they're lowering their prices by 80, 90%. So they don't understand why. Even he talked about the injections, the weight loss injection prices going down. So,
Mm-hmm.
and so people are saying, all I hear about is the prices going up. What is going on? They don't understand that.
Well, yeah, and that's the thing is it hasn't really hit the consumers yet, right? So that's
Right.
talk and that's what they want to do, but it hasn't really come into fruition for the consumers yet. So, it does take a little bit for that to happen. We have seen significantly the drug costs have come down due to the
Mm,
Inflation Reduction Act that started January of 2025. So last year, the Inflation Reduction Act did bring the cost of some of the medications, like the Ozempics,
right.
the Trulicities, the Farxigas, all the diabetic, and then the AFib drugs, the Xareltos and Eliquis. Those prices have come down significantly, but you're still paying a little higher. I can tell you, I'm doing some of the weight loss medications too, and I'm paying a lot of money monthly. It's not cheap.
Me too, Susan.
Yeah.
The first 6 months I had a $30 copay,
I
which
wish I
is
had a
still
$30
cheap.
copay.
And then the final 6 months, I haven't had to pay anything.
Pay
Now it's going
nothing.
to start back up again
Yeah.
this month, but
Yeah.
and I'm on Ozempic, and
Yeah.
I got to tell you, Ozempic's like $1,000. So the Medicare has paid for a lot of it.
Yes. Yes. That's
Mine
correct.
has.
Yes. And that's the nice thing is that the medications have a cap for Medicare. For this year, it's 2,100. So you will never pay more than $2,100 in a calendar year for any medication. So there's a lot of details that go into that $2,100 cost. It's based on your deductible, it's based on what you pay, the drug manufacturer pays, the insurance company pays, and what Medicare pays. So it's really not what you pay $2,100 out of pocket. It's a combination of all of them that reach that $2,100 cap. So it's
So
very
if you're
confusing.
on 4 or 5 different medications, is that combined or per
Combined.
medication? Oh,
Nope.
okay.
Mm-hmm.
Okay.
Mm-hmm. Yep. So I did want to let people know. So speaking of, Washington, D.C. and all that stuff, I am going to the Capitol Conference in Washington, D.C. in
Mm,
February as a local Medicare agent to go to Capitol Hill. I am going to be speaking to the Congress and legislators about
wow.
Medicare. Yeah. So
Wow.
I'm excited about that because look, I hear it every day from my clients and people
Yes.
that are out and about in the public. The people in Washington, D.C. have no clue what's going on with feet on the street, me hearing what you have to say. So I'm going with a bunch of agents from around the country, and we're going to Capitol Hill to talk to the
Wow.
legislators about this. Yeah.
Amazing. Now, I want to get this in. If someone hasn't received their Medicare Advantage ID card yet, what should they do?
So depending on the insurance carrier, some like we can pull some of them and send you a copy of them and request them for you to be sent. Some insurance carriers make you call and request it yourself. But for the most part, just call us and we could usually guide you in the right way. But you should receive your card within 7 to 14 days after the enrollment. If you're renewing your plan, most plans do not send out new cards. It's only if you changed your plan would you get a new card.
Mhm. Okay. Is it true that even if you don't change plans, things can still change every January?
Yes, and that's that open
Uh,
enrollment, January 1st through March 31st. And if you don't like your plan or you're like, put me back where I was or change it to something else, we can do that first quarter of the year. Yes.
here's I think is an important question. Which signs should someone look for that indicates their Medicare plan might not be the best fit for them anymore?
Well, when they go to the pharmacy and their
Yeah,
prescription is not covered,
right.
if their prescription's not covered, then that's a red flag right there. Or if they go to the doc to make an appointment to go to a doctor and they're like, oh, we don't take that plan anymore. That's another red flag. So those are, and usually in January you find that out because everyone starts going to the doctor again, starting
Right.
their year off with their doctor visits and stuff like that, and their prescriptions being filled. And there you go, not covered doctors and not covered prescriptions. That's your key indicator that the plan doesn't work for you.
Again, just want to remind we're going to be replaying this show this afternoon at 5:25 Eastern Time. And so if you want to turn some friends onto it, this is such an important subject, very dear to my heart. Uh, what happens? I guess there's people out there who just ignore all this and just hope everything works out. What happens to those people?
Well, I here's a story that I had a gentleman who was in his late 70s calls me and says, I never got on Medicare. And I'm like, what do you mean you never got on
Oh,
Medicare? And he goes, I didn't want to have to pay for it. I already paid all my, time into Medicare. I should get it for free. Well, it's not free, unfortunately. And so he's like, well, I'm not paying for it. Well, guess what? He called me because now he was sick. And 10 years after he was supposed to enroll in Medicare, he would have a 10-year late enrollment penalty. So that's 10% a year times 10 years. That's 100% basically. He would pay
wow.
additional money every month for the rest of his life on Medicare. So, everyone's like, I don't want Medicare, but you know what? You kind of do
Yeah.
because you never know what's going to happen tomorrow in 5 minutes from now or anything. You've got to have insurance coverage. It's a necessary evil, unfortunately, but you got to have it. Just like you got to have car insurance, just like you got to have home insurance. You have to have something to cover your health because medical costs are so darn expensive. You do not want to, waste your nest egg of finances and have to rely on family members to help pay your bills.
Susan, this is so strange. While we're doing the show, I think about my first Medicare agent, and he was so boring. I had no idea what he was talking about. And I got to tell you, it's so refreshing hearing you. Your passion just
Very.
is amazing. And you're so educated on this. And now we got you as a superstar going to Washington, D.C. Wow, that is amazing. Maybe you'll be able to give us some screenshots and we'll show it on your show in February. But Susan, we are so blessed to have you. I know people can see on the screen on YouTube how to reach you, but we have so many people on iHeart, and radio, and Spotify who are listening. How do people reach your office?
So there's a couple ways. We are located in New Braunfels, Texas, off I-35, just south of Buc-ee's. So everybody knows where Buc-ee's is. So you can't miss us, right off the frontage road. You can also call us at 210-767-9876 or go to my website at www.medicaregals-st.com.
Susan, we are so blessed to have you. You'll be back live again with us next month. Again, don't forget to tune in this afternoon if you've missed any of this or you have a friend who's getting ready to go into Medicare, because that's what we do. I don't want people to have to go through what I went through with my first agent. This afternoon at 5:25 Eastern Time, www.w4cy.com. Susan, Happy New Year to you.
Happy
We'll
New
see
Year.
you next month.
Sounds good. Bye.
Thanks,
Thank
Susan.
you.
That's Susan Shin. God, she's such a great agent in the San Antonio area. That's going to do it for us today. We'll be back in with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.